False positive pregnancy test results are extremely rare because pregnancy tests are over 99% accurate from the day the period is due. However, it's possible to get a pregnant result and then test again and get a negative result, or your period may start. This is most likely due to natural loss during the first few weeks of pregnancy, known as early pregnancy loss. Sadly, this can be quite common, with pregnancy loss occurring in approximately 1 in 4 pregnancies. It can be very upsetting to get a negative result after first testing positive and can lead some people to doubt the accuracy of the pregnancy result they initially received. This is where the term false positive usually comes from. However, you can be reassured that true false positive results are extremely rare. If you get a positive result at any point, then it is almost certain that you were pregnant when you took the test. Your doctor may do a blood test to check for pregnancy, which can sometimes come back negative, even though you may have had a positive test result at home. This is because pregnancy hormone can disappear quickly after an early loss, so a blood test or a second pregnancy test may give a negative result, even if done soon after you get a positive result at home. Doctors don't always recognize a pregnancy that hasn't been confirmed by ultrasound or a blood test, even though there may be a rise in pregnancy hormone HCG. They may not call this a pregnancy, as it may be too early to detect by a scan. The likelihood is that you have suffered an early loss between the home pregnancy test and a laboratory or blood pregnancy test. There are many different reasons why early loss occurs, and it is often difficult to know exactly why it has happened. You may never know why, but it's important to remember that most women who have suffered early loss go on to have perfectly normal pregnancies. You might be told that you had a biochemical or chemical pregnancy, which simply means that you were pregnant, but it was so early that it was not possible to see the pregnancy on an ultrasound scan. If you've had 2 or more pregnancy losses, or you're in any way concerned, then you should talk to your doctor or other healthcare provider. For most women, there's no reason why they couldn't go on to have a healthy pregnancy after early loss. While it may be a very upsetting experience, it is important to remember that early loss is a common occurrence that unfortunately happens to quite a few people. Everybody has their own reaction, and there is no right way to feel. However, many patients tell me that despite the negative feelings, they feel some reassurance in knowing that they did conceive. For more information, or if you want medical advice, you should consult your local healthcare provider in your country.